mental health services and support for elite cricketers. I'm Craig Ranson. My job is Athlete Health Director for the UK Sports Institute, so looking after the Olympic and Paralympic sports and athletes in the UK and their health programs. And Nick is the Chief Medical Officer of the England and Wales Cricket Board. What we're going to cover is looking at an approach to mental health support for elite cricketers, giving some of the principles that we apply within elite sport, starting off with Olympic and Paralympic sport, and then I'll hand over to Nick to talk about some cricket examples. So again, this was my trick from yesterday. So best thing to do nowadays, if you've got a question or a problem, is to ask your AI chatbot. So I put into ChatGPT this time, what elements should be included in injury and illness prevention program for elite cricketers? Came back with a very comprehensive answer. There were 12 different aspects of injury prevention for elite cricketers. Very good summary at the start saying how that should be comprehensive and holistic. And there was one section which talks about mental health. Actually talks quite well about mental health, and it talks about developing resilience and having good support services, but it's 1 out of 12, where actually nowadays it's probably at least 50% of our workloads is looking after mental health. We look at some of our data from elite sport. We have a database for our medical record system over 5 or 6 years for 2,000 athletes, Olympic and Paralympic athletes, and there's 333 medical records in there up to 2021. That resulted in 7,000 days of training being impacted. So either restricted training or loss of training due to those mental health problems. That's a lot of training being missed. The two biggest diagnostic categories within that were anxiety and depression. So this is really good information because it allows you to know where you need to focus your efforts in particular in tackling anxiety and depression making up over 50% of the burden. And we're seeing a year-on-year increase. So you can see back in 2016, there were 45 cases recorded across our 2,000 athletes, 125 in 2021. That's probably up to closer to 200 for this year, 2023. So again, probably due to increased awareness around mental health problems and greater reporting. And that's probably a good thing because less stigma probably means that more people are coming forward to talk about mental health and presenting to their medical teams. 3 major pillars: plan, deliver and learn of our mental health strategy that our team works on, supporting sports to develop and implement robust mental health strategies within the sports, ensuring delivery of high quality mental health support, advice and care, and learn. And this is particularly important. So raising awareness, raising education around mental health, helps to help with the stigma of talking about mental health problems and make people more aware so they're more likely to present, but also in promoting positive mental health within sporting environments. So we do education courses for coaches, administrators, athletes, and support staff. We have a mental health team, which includes clinical people, psychiatrists and clinical psychologists, but also a mental health officer whose sole job really is concentrating on that education aspect. And we have a provider network outside of sports where they can go to see specialists, and there is mapped across the United Kingdom, and there's 130 psychiatrists, clinical psychologists, psychotherapists who we can refer to, and we provide some quality assurance around those. We know that their registration status, we know that they are members of the insurance that we scheme that we use, and we provide to get some feedback from them, and we get feedback from the athletes that are seeing them to quality assure those services and make sure it's available across the country. Last thing I'm going to mention before I hand over to Nick, I had a presentation earlier today in here on mental health assessment in cricketers in South Africa. There are lots and lots of different tools around in terms of questionnaires for identifying people with mental health problems or their state of their positive mental health. And so the IOC, the International Olympic Committee, have done a really good job in producing this comprehensive screening tool called SMAT, the Sports Mental Health Assessment Tool, which we are now using across our 2,000 athletes so that we can get some standardised information on the state of their mental health. It's 3 stages. The first stage is only 10 questions. It's done electronically. The athletes can do it on their phone, and that gives it a cut-off. If they're over 15, they score over 15, they then go through with their doctor to work through the 2nd and 3rd stages. But it's a really good way of segmenting the athletes to work out who needs further investigation, potentially further support. I'll just hand over to Nick now, who can talk about some of the examples within the cricket environment.
Thank you very much, Craig. So I'm just going to illustrate from within the ECB just a couple of elements of the program that we try and run for mental health. And I think just this slide is really trying to emphasize that our responsibility is as an employer and as the medics, we're part of that framework where we're actually trying to ensure both immediate and long-term health care of our athletes. So what is it that the journey in cricket looks at, and what's the end result look like when they move on from cricket, and we're there for that whole journey. And I'll touch on that in my next talk, which is in about 5 minutes, on research in mental health, but I'll try and avoid that for the moment. So I think the first thing that any environment around mental health needs to try and understand is, have you managed to move the stigma on? Has the dial moved such that you can have the conversation, that people are open, that there is some degree of help-seeking behaviour possible within the environment, or is the environment so closed? And these are a couple of examples. So Marcus Gustafsson and Jonathan Trott, who both came home from tours, probably because they'd gone on tour under pressure to go. And the very first, certainly, example with Marcus was when probably inappropriate diagnosis before touring, had a very strong situational anxiety. It wasn't appropriate for him to go. Came back in a very public-facing event in our country, and actually single-handedly Marcus and the work that he's done in mental health has moved the dial forward in our organisation such that it's a pretty open conversation now, and I think it's a pretty open conversation within the whole of our game across the professional network. We've travelled with sports psychology for a long time now. Steve Bull here is a very experienced, excellent sports psychologist, had deep trust of the players, but worked within an MDT, so there were doctors and physios. And the reality is he didn't try and make clinical diagnosis, he just created good conversations with players around all sorts of things. So whether it be choking, whether it be performance anxieties, whether it be the difficulties at home, the wife was phoning because the toaster didn't work, or whatever it might be. You know, in the men's tours at the time, that was a predominant feature, was relationships and at home with the pressures. But we realized that actually, you know, that's not going to help us really understand our players. So we brought clinical psychology in 2008. We started to do mental health training. And then we brought in a group. We went to open adverts, and a team of forensic psychiatrists that would work with adolescents came in provisionally to work with our developing players so we could try and start to understand our problem child, shall we say, within our group, and then help to understand how to manage them better. Because you'll probably know within any of your teams that, you know, 80% of your work is in 20% of the players, those that have come from difficult backgrounds, whatever it might be, that more dysfunctional, more disruptive, more challenging, require the greatest work. So we were trying to understand project players. We have a policy, a philosophy that, you know, we can obviously maximize our availability and have winning teams, but we can only really do that if we've got players that have got sustainable careers. So their welfare is, you know, paramount, that underpins their ability to perform. We need a support network, as Craig's alluded to. They've got a great team at of sports psychology, clinical psychology, although they looked a bit like out of the SAS, I thought, in that picture. And they have an extensive network across the country. So we built our network within the game. So every county has to have a clinical psychologist attached to them, every region, and a sports psychologist is optional, actually. The clinical psychology is more important within the actual welfare MDT, but they have to have CMOs, doctors, and physios. And then finally, actually, we need to make sure that we understand that we're operating within what the accepted, you know, I guess society standards are. So, you know, some sports are operating outside of that and they're running into trouble, whether it be rugby and concussion. I think most people think that the game's too dangerous, but they're struggling to move with the times. Other areas of sport have other challenges. And so constantly that's our sort of bar to operate by. I'm not going to talk through this. It's just a huge list of the things that we offer within our game, but safe to say that we're now offering and trying to provide support across two domains, so men's and women's, and we're rapidly learning about the women's environment and some additional challenges for this rapidly growing profession, women that have come into a sport from a very you know, low exposure to some of the pressures and social media inspection that goes on in their game, you know, and these are providing all sorts of challenges. And the pyramid in the men's game is is pretty large, and so people who fought their way through may not have been able to get through with some subtle difficulties, but we're seeing the women's game coming through, the 17, 18-year-olds suddenly being offered contracts at a region, and it's much easier to get to that level despite the fact that they've got issues. We need to look after them in retirement, so we work with the PCA, and they have a program of support throughout the game. We audit the counties in relation to the level of support they deliver. They have to have a welfare MDT, which implies that effectively information is shared, but confidentiality is maintained. So I'm the doctor, and I might know that the person has a recreational drug habit, which isn't necessarily illegal, but is within the game, but is an issue. Someone else might know they're gambling. Someone else might know that there's a relationship difficulty. Someone else might know that they haven't signed their contract, and the coach will know that their form's terrible, or probably everyone knows their form's terrible. So you've got this confluence of information that suggests that you need to be utterly concerned about a player, and that acts as a catalyst for supporting them. We have a recreational drugs policy. We have a duty of care department that looks after all of this aspect, so it's separated from performance. So the clinical psychology doctors, actually the coaches can't come in and decide what they think is the right or wrong thing to do. You know, we heard about whether you'd have a physio doctor in a team, and they said, well, no, it'd be two coaches. Well, they can't do that in our case. That's employment has cemented that program in place. Confidential medical records, PhDs. We understand growingly that the cost for mental health is significant, and we're trying to do some more to delve into that area. So I think that's me for now. I don't know if you were planning on finishing on anything, Greg. Otherwise, I'm ending by the looks of it, and then